Welcome to Balanced Life with Debbie Carlin Boyle. Conversations connecting to a healthier you. The show that gives you all the latest and greatest health and wellness information to inspire you to live a life of balance and joy. Debbie Carlin Boyle is a health and nutrition coach, personal trainer, and fitness instructor who helps her clients live in balance with everything that feeds us, in addition to the food on our plate. Please welcome your host, Debbie Carlin Boyle.
Hello, welcome everybody. Welcome this afternoon, depending on where you're at in the world. I do realize from some of the comments I got on my Facebook page today that there are people listening from all over the world. So welcome whatever time of day it is. We are live here 2 p.m. Pacific time here on the West Coast in sunny California. We're right here pretty much adjacent, almost on the Warner Brothers studio lot. So we're real excited to have you join us today. If you're not watching live, thank you for joining. There's going to be some great information, so stick around to hear what our podcast is all about today. And I also want to thank you for coming here and for with me. You've reached my show, which is Balanced Life with me, your host, Debbie Carlin Boyle. This is conversations that connect to a healthier you, and that's what I hope I do twice a month here is I find experts in the field of health and wellness to help you live your best life. And today we have a show really interesting about adrenal fatigue, and you may have symptoms that you're attributing to something else that's going on in your body, and we may be able to zero in on what's going on with you today. So stick around. You're going to want to listen to this. But before we do that, I want to tell you how you can get in touch and work with me, because I'm a health and nutrition coach and a fitness coach. So I can do many things for you all at once to give you that balance that you need, that we all need in life. So we don't live on adrenaline, but we live a healthy, balanced life between our food, our sleep, our exercise. If you're watching the show, you'll see on the screen right now, it shows you all the things that I'm about. And I want to tell you how you can get in touch with me. You can go to my website, which is up right now, which is Balanced Life by Debbie, spelled DEBI.com. You can go to the website, you can go to my Instagram and private message me, or to my Facebook page. That is where we're streaming live right now on Facebook. So all my shows, I do have a whole catalog of shows on Facebook on health and wellness. But if you want to make a comment or ask a question, you can go there. And then I also have a YouTube channel where a lot of my shows live, and I eventually transferred them on there. And that is Balanced Life by Debbie YouTubes, again, spelled DEBI. And you can go there, make a comment, ask a question anytime from a post show, and myself, or I'll get a hold of a former guest and they'll talk to you directly and get back to you. So it's never too late to keep these conversations going. That's what this show is all about. And that's part of the reason why I do it live. And if you're listening or watching live, you have the opportunity to call in today and talk to my special guest. So the number here is area code 323-524-2599. Again, that's 323-524-2599. Now, if you're driving, and you can't take the number down, don't worry. Make a comment or ask a question when you get a chance on my Facebook page where we're streaming live. I'm checking Facebook throughout the show, and we will answer those questions for you today. But if you can call in and pull over, by all means, call in. The number is up on the screen. So, but again, it's 323-524-2599. We'd love to hear from you. So thank you so much. If you get a chance, I'd love for you to subscribe to my YouTube channel. Go ahead and friend me on Facebook at Balanced Life by Debbie and Balanced Life by Debbie Instagram, because by following me, you're going to get so much content and information about living your best life. And reach out to work with me on my website right away. I have a pop-up, which is a free 3-day detox for the fall. There are recipes that are made for right now, this time of year. 3 recipes a day for 3 days that are healthy, that are going to make you feel lighter on your feet and just give you the jump start you need to live, a really healthy fall going into the holidays especially. So there you have it. I'm about to introduce my guests and get on with the show. So most of us have heard of adrenal fatigue, but can you actually define it? What is it really, and how can we heal from it? Chronic, unexplained body-wide symptoms baffle the medical world. Most family doctors and even specialists do not believe in or fully understand the true underlying cause and well-documented links between these ailments. Adrenal fatigue can leave you feeling as if your body and brain are damaged beyond repair. My guest today is Dr. Andrew Neville, who is a licensed naturopath doctor that specializes in adrenal fatigue with 20 years of experience. His holistic treatments have helped thousands, you hear that? Thousands, get their lives back from mysterious chronic illnesses. Dr. Neville's primary goal is to help you understand the cause of your condition and give you the tools to heal it for good. He practices in Pennsylvania and has online treatment programs for adrenal fatigue, treating patients all over the USA. So let's get into it and get you on the road to excellent health. Will you please welcome my guest, Dr. Neville, to the show? There's the audience. Told you they'd be there.
Much
Hello.
appreciated.
Welcome, Dr. Neville. How are you?
I'm doing quite well. Appreciate the opportunity to be on with you.
Oh, I'm really happy to have you. I think your team reached out to me, and I jumped on it right away because this is near and dear to my heart, and I'll tell you why as we go through. But this, not only do I know what symptoms I have, I took your little quiz today online, which we'll talk about, but and I didn't pass, by the way, but there's so many people I know in my lives, including my daughters, that I know need to heal because they're living on the fast road and their systems are not functioning properly because of it. And they get sick a lot. So we're going to talk about the whys, the hows, the whats of what is adrenal fatigue. But before we do, I want the audience to get to know a little bit about you, and where you're from, where you grew up, and what steered you into the path of where you're at now. So you're up.
Sure thing. So I ended up growing up in New Jersey, a small town about a mile from the beach in the North Jersey Shore, a little town called Oakhurst. And it was a fairly normal kind of suburban kind of upbringing, never really wanting for a whole lot. No major kind of trauma or stresses really in my life at the time. In retrospect, I started developing some symptoms even when I was in high school, but it wasn't until college that I started noticing things were kind of off for me. And it was, just, some anxiety or, some bowel problems. And, maybe I get sick a little more frequently than somebody else. And there was a couple times where I was pretty well laid out, in my dorm, like almost like a month at a time kind of a thing. I started going to the infirmary in the college and looking around and trying to ask questions and see if I could get some care, but I never really got any great guidance. With time, I think really just time and I think it was time is really basically it, that I kind of, inched my way through and I got better. It was after I graduated with my undergrad degree in economics of all things, right? After I graduated with that degree, I started working and doing some things, but I started to learn what I liked and didn't like, and started kind of learning my path. And, but I was still having problems, right? I was having those gut problems, and I started seeing some alternative practitioners. And it was a chiropractor actually who mentioned naturopathic medicine, which I had never heard of before. I didn't grow up kind of doing herbal medicine and, hugging trees and things like that, right? So it was brand new to me. Once I looked into naturopathic medicine, I mean, my path was kind of set because the philosophy of naturopathic medicine was just right up my alley, kind of seeking, the cause of underlying illness, and kind of utilizing the healing power of nature, that kind of a thing. So, my path was set. I go to med school, and when I went to med school, all my symptoms start to get worse. And
Stress.
it was stress for sure. My bucket was full while I was in med school, and so I had all these symptoms, and it was interesting because a lot of my research started pointing me in the direction of chronic fatigue syndrome and fibromyalgia, which are these kind of strange, also ambiguous kind of conditions, right, that are very poorly understood. That research actually directed me to kind of my library at Bastyr University, where I found a book written by my predecessor, Dr. Posnecker, all about adrenal fatigue. And once I read that book, I was flipping through pages in that book. It was all about me. It kind of described all these problems that I was having. And it was ultimately with that book and also the guidance from Dr. P, as we called him, where I was able to kind of incrementally kind of get back on my feet. I came out here and worked with him several times in preceptorships, did a residency with him, and then really just took over after he passed. Adrenal fatigue, which I discovered that I was dealing with, which I had no idea. It's a really difficult condition. It's very broad. It encompasses a lot of different systems in the body, and it's not what is out there on the web. It's more than just a problem with your adrenals, and that's part of the challenge. So, for the past 20 years, I'm trying to get the information out there and try to help people understand what they're dealing with and really get ahead of it so they can, ultimately get their lives back.
Right. Because so many little chronic things that happen to people, whether it's headaches that keep coming back, or you're fatigued and want to fall asleep at 4 o'clock in the afternoon and you're living on caffeine, and you think having a glass of wine or something at night will calm you down, which is really exactly the opposite of what it will do. Those kinds of things are not a cure. They're actually sort of fueling the flame. So, people don't realize that, because I think it's a very ambiguous term. So let's get into what does adrenal fatigue mean, and what are our adrenals? I know it's a hormone, but you go ahead and you give us the whole official breakdown.
Sure. So the challenge with adrenal fatigue is how poorly understood it is out there. When we look towards, and I guess I'll give you some basic background. So the adrenals are part of your endocrine system, your hormone system. They produce your main stress hormones, right? Cortisol and adrenaline, those kinds of things.
Those are the fight or flight hormones.
Fight or flight hormones, for sure. And I give those hormones quite a bad rap. Quite a bit because of all the damage that they cause, but they're life-saving. Like we wouldn't be here without those hormones. You just don't want too much, and you definitely don't want too little.
Yeah, they are our fight or flight. So they're the ones that, I guess, if in the days of cavemen, if they were being chased by a lion or a tiger, whatever it may be, you have to take flight, and that's your adrenaline pumping to get you. We need them for survival, but not to live on and off of in a day-to-day world, correct?
100%. 100%. It's absolutely true. We have to use these hormones, right? The problem is when we kind of get stuck in fight or flight, stuck in stress physiology, that hormone that if you use once in a while, it'll save our life. Excess of that hormone over time creates tremendous wear and tear in the body. And that these are hormones that cause wear and tear. The metabolic exhaust, if you will, of fighting tigers also causes damage. These are free radicals and oxidative stress. So the free radicals and the hormones that cause the damage, they're in the blood supply. And the blood supply goes everywhere, right? Which means the damage is ultimately everywhere.
Our organs, our systems.
Inside and out.
Yeah.
Everywhere. And that's what leads to these symptoms that we associate with adrenal fatigue, which are fairly predictable, which you kind of alluded to in taking that questionnaire, right, that's on our website. You'll see fatigue, pain, weight issues, insomnia, brain fog, cognitive stuff, anxiety, depression, even blood sugar problems and blood pressure problems. Those actually start out low, but eventually they can go up. And all those symptoms, even in conventional research, when we research these symptoms, there'll be a little blurb in the research article that'll say, oh, by the way, chronic stress can cause this. But conventional medicine is not necessarily set up to fix that chronic stress thing, right? So it's about chasing the symptoms, right? And, taking medication for your anxiety or depression or
just gonna say
your
that.
sleep or your weight or whatever. And you can do this quite often in alternative and natural medicine as well, right? Just a little nicer, right? It's like taking, 5-HTP instead of Prozac or something. If you're lucky enough to pick the right drug or herb, you might cover up the symptom, but you haven't fixed the underlying problem. And that underlying problem, meaning that physiology, which is still stuck in fight or flight, that damage persists.
And it's going to cause something bigger down the line.
You got it, right?
Yeah.
Right. So I'm not against you chasing after symptoms, but we can't kid ourselves and think we actually fixed the problem. All we've done is kind of put a little piece of tape over the check engine light in our car.
And, I talk about this often on my show with the experts I have on, but, conventional medicine has a habit of putting a Band-Aid on things and sort of living with the symptoms, but making them a little less severe, let's say, calming them down without actually getting to the source and to heal. And that's why I love what you do. And I love this. We're going to get into your protocol because you heal and you have to really work backwards and individually with each one of your patients, I imagine, because the onset or what their symptoms are probably different. What it is that the secondary illnesses that this is causing are different. So the protocol on how to treat the treatments would be different. And it isn't a one-size-fits-all thing. And I think conventional medicine is really that, just here's, I used to remember when my kids would have to go to urgent care because, suddenly what was a common cold turned into some sort of infection, or it was just a common cold that wasn't going away. So we'd go to the local urgent care and no matter what you went in there for, even a cut on your leg, you always got an antibiotic and a steroid. Those were the two things. It was just protocol to do that and send you away. But it didn't really fix why you keep coming back with these chronic colds. It just drove me nuts. It drove me crazy. It's kind of what steered me to do what I do today, because that kind of treatment wasn't treatment. It was get you in, get you out kind of thing. And not to say that the Western medicine is needed and important, but it isn't as simple as some of these ways doctors treat us. The average doctor, I guess, spends 7 minutes with the patient. That's not really learning about them and really what's going on. So I think it's great what you're doing.
Yeah, for generations now, we've been kind of raised in this model of one drug for one disease, right? That kind of germ theory type of model. You've got an infection, take a anti-infective or microbiotic, whatever it is, right? And deal with the infection. Well, the conditions that we deal with today don't fit into that model. And unfortunately, conventional medicine's kind of still stuck in that model. And that's the challenge.
Yeah. And I'm sure you're trying to undo or trying to override that when patients come to you to help them to understand that there is a way to heal and not just live with a condition. You have your work cut out for you.
Well, there's a fair amount of education that goes into that, that's for sure. And what it starts with is the fact that adrenal fatigue is not just adrenal fatigue. The adrenals are part of a much bigger system. And for there to be adrenal issues, which is fairly easy, you can look at symptoms, you can get testing, which we should get, testing for that. And if there's an adrenal problem, there's got to be a problem with the rest of this system that the adrenals are attached to. So the best, well, not the best, but at least the most accurate name to give this condition would actually be to call it a stress response system dysfunction. And the adrenals are part of your stress response system, right? They're releasing those stress hormones we talked about. But the adrenals don't decide whether or not to release that hormone, right? Somebody tells them what to do. So if we go up the kind of chain of command, so to speak, we get into the brain. There's two master endocrine glands, the hypothalamus and the pituitary, and they tell the adrenals what to do. They also control your ovaries and your thyroid. And I'll tell you, if your adrenals go south, they are going to drag down those other two as well. Mm-hmm. Hopefully I get to make that connection. But that's only one side of your stress response. There's also a nerve side of your stress response, which is your technically your autonomic nervous system, part of the nervous system controlling the organs. And those systems work together, although, they're different and symptoms might come from one side or the other. Treatment might be a little different as well. Neither of those two parts of that stress response system actually calls the shots. The CEO of your stress response is actually a step above the hypothalamus in a deep central part of the brain. It's called the limbic system. And the limbic system it's not a thinking part of your brain. It's part of our reptilian brain, kind of a reacting part of our brain, controls some basic functionality like appetite and hunger and temperature regulation. Even sleep-wake cycles are initiated up there. But the main job of the limbic system is to constantly be assessing your environment for danger. It's always assessing the external environment, receiving information from senses and perception. It's assessing the internal environment, receiving information from chemicals in the blood supply. When it receives that information, it's just got to react. Is this stimulus harmful, dangerous? Can this thing kill me? Do I have to jump this body into fight or flight, right? Mm-hmm. Hormones, nerves. Or is it the opposite? Is it harmless, innocuous, and I can just kind of chill out in vacation mode and let it pass? So what happens is, with a bit of a genetic predisposition and just enough chronic stress over time to overwhelm those genetics, that limbic system actually gets trigger happy. It gets sensitized so that minor stressors don't generate a minor response, minor stress, major response. And now our limbic system is kind of making mountains out of molehills. What happens then is our physiology starts to get stuck in fight or flight. This is not good, because when you're stuck in fight or flight, you're dumping excess stress hormone in the beginning stages of that condition. Of course, that is what leads to all the symptoms. And at the same time, you're suppressing a bunch of other physiology that's actually pretty important when your body's fighting tigers. There's 4 primary organs that get suppressed. There's others, but 4 main organs: immune, digestive, reproductive, and thyroid. And again, we know that that's conventional physiology, which makes sense, actually, because you're fighting a tiger, right? You don't want to waste energy healing some inflammatory response or fighting some chronic infection, right? Forget about that. Deal with this tiger. Same thing with the gut. We just shut it down. Don't waste energy digesting, absorbing. Don't really want you to sit down for a meal or have a bowel movement, right? There's a tiger in front of you. Mm-hmm. You're going to be lunch, right? Mm-hmm. Reproductive hormones go the same way. We don't care about your periods or your sex life, right? Don't really want you to procreate right now. There's a tiger. And we know the same thing happens for the thyroid, that stress hormone suppresses the thyroid. Now, if you do that once in a while, saves your life. Conserve energy here, deal with the threat, and then shift back. Do it all the time, of course. Now you're going to compromise these systems, and you can start to develop those some symptoms in those systems. But what's also happening is you're chronically suppressing the organs that the body uses for healing and repair.
Just going to say that. Yeah.
So now, right, over the years and months and days, months and years, we have this physiologic equation of excess wear and tear coupled with suppressed healing and repair.
And it leads to disease. Yes. And so we're going to take a quick break here in a minute, but before we do, name a few diseases that when you can't heal and repair, because our systems aren't working properly. What are the diseases that we're allowing in by living a lifestyle like this?
Oh, numerous, right? I mean, certainly chronic fatigue syndrome, fibromyalgia, right? Those are big ones, but even just basic stuff, right? We're talking about cardiovascular disease, diabetes, cancer, autoimmune disease.
Heart
I mean, you can
disease.
tie heart disease, you can tie this physiology to as an underlying cause of many problematic disease. My patients are diagnosed with hypothyroid and irritable bowel syndrome and inflammatory bowel disease, chronic illnesses, even allergies, asthma. I mean, the list goes on.
It's huge. And people, again, what we were saying in the beginning, they have those, but they don't attribute it that this is an adrenal fatigue situation that can be dealt with. But they don't work that backwards to realize that. We're going to take a quick break because we're halfway through right now. And remember, you can call in. The number here is, if you're watching live, 323-524-2599. If you're on the East Coast, I know it's a little bit later, approaching dinner time. If you're here on the West Coast, we're smack in the middle of a workday on a Tuesday. But if you are and happen to be catching us live, call in. We want to hear from you. What do you think? Have you had any of these symptoms before? Do you know someone who you think may have adrenal fatigue? Do you have a question? Call in, and we'll be right back right after this message from one of my sponsors. Without looking at labels, do you actually know what is in the cleaning products that you use in your home? If you haven't addressed this yet, it's likely that you are spraying toxic and dangerous chemicals in your home. 3 common ingredients that you want to avoid at all costs are ammonia, fragrance, and bleach. These ingredients and chemicals can contribute to chronic respiratory problems, allergic reactions, allergies, cancer, hormonal issues, headaches, and more. So what's the solution to a healthier, clean home for your family? Teas Organics all-purpose cleaner and room sprays. Teas products are formulated with the power of an essential oil blend. Her all-purpose cleaner gives you a clean surface, shower, toilet, or simply just use it to spot clean or dust, and all without harsh chemicals. And to make it even better, Teas Organics all-purpose cleaner uses 100% organic essential oils and has a sweet yet spicy herbal aroma with hints of citrus. Imagine a fresh, inviting scent and sparkling clean home that you know is free from toxic, potentially harmful, and cancer-causing chemicals. I use these products, and I can personally attest to all of the above. And right now, enjoy a 15% discount by applying 15DEBBI, D-E-B-I, to your order. So check out these amazing products by Teas Organics that are healthy for you and your home. We are back. Welcome back. We're with Dr. Andrew Neville, who is an expert in treating adrenal fatigue. And we've just talked about what it is, what some of the symptoms are, and what it causes. I want to talk about what are some of the early warning signs of it. But I do have somebody reached out on my Instagram. I think I was looking on my Facebook page. I want to go to my Balanced Life Instagram because somebody had a question, and I want to make sure that we address it. And let's see. Okay, so actually, she is from she's from Ireland, and she reached out this morning. And I was wondering if I could please ask, what causes brain fog in adrenal fatigue, and what would Dr. Neville recommend to help this issue? Because I know it's one of the symptoms is brain fog. So
it is one of the symptoms for sure. It's pretty common, and we kind of lovingly call it brain fog, but it's significantly disabling, right? The lack of focus or decision making or memory or long-term potentiation. I mean, people kind of gradually lose even their ability to read and to pay attention, and so it can be significant. The brain fog is basically believe it or not, it's damage to the brain, right? On a microscopic level, on a neurological level, there's damage from that excess stress hormone and this thing called oxidative stress. These free radicals kind of get into the brain and they nick and damage pathways. Now, this is reparable damage. I wouldn't bring that up. If you couldn't fix it, it's reparable damage. It's not early onset Alzheimer's or dementia. You can fix it. The thing is, you can't chase after it. Trust me, I've used all kinds of numerous, you can, there's all kinds of people selling all those different supplements, right, to fix your brain and everything. I haven't been pleased with just about any of them consistently, but what does fix it is shifting this physiology. When we're able to shift this physiology, turn off the wear and tear and turn off that damage, turn on the body's ability to heal itself, right? And these symptoms, all of them, right? The fatigue, pain, sleep, brain fog, weight, all of them, little by little, they decrease in intensity, frequency, and duration. So hang in there. The brain fog can definitely be dealt with. We just can't chase after it. You've got to work on fixing this underlying problem.
And that's,
This physiology, that's the key.
It's lifestyle change, because for people who don't know my story, but when I started college, I was a processed kid, right? So I grew up with processed food. So I went in my first year of college with brain fog. Like my nails were brittle, my hair was falling out. I was a wreck basically because I lived on fast food and processed food. There were 4 kids in my family. My mom didn't cook. I mean, it was this whole scene. And I thought, well, I don't feel good. I don't necessarily look good. I'd like to attract a boyfriend, or I'm in college. It's my first year of college, so I started eating off of salad bars and went off the meal plan and all the yellow food in the commissary, and instantly I started to feel better, which yielded me wanting to do better. So I started to sleep longer. I started to, even though I was in college, drinking wasn't a thing for me because I was feeling so good. And I started to see the physical and the mental changes that were causing it in the first place. And it was just something that I didn't realize I was bringing on myself through bad diet and no exercise. I started on the tennis team. Things changed for me when movement, sleep, and correct diet came into my life. And granted, I was young, so I was going to heal pretty fast. I was 18, but it's never too late. And like you said, there's a genetic component, so you have to kind of work backwards from there. But let's get into that. Like what are the early warning signs of adrenal fatigue so people can kind of figure out whether or not they are actually living on adrenaline?
So 2 of the earliest warning signs, and a lot of times as I'm talking kind of through a patient's history with them, we'll talk about these warning signs are low blood sugar, right, or hypoglycemic episodes, and also low blood pressure. Now, the blood pressure can go up in time, but a lot of times if there's low blood sugar, low blood pressure, your adrenals actually control both of those. Those are quite commonly one of the earliest warning signs. Beyond that, and people will say, oh, I've had that stuff forever. And I'm like, well, guess what? You've had this tendency forever as well. But it goes beyond that, right? We can start to develop, some of the focus problems, the brain fog that person was asking about. We can start to have, more frequent illnesses and colds and flu, just getting sick a little more often. Weight can be a problem. It's essentially kind of a smaller version of all these symptoms that I just rattled off, whether it's the weight or pain or poor wound healing, but even anxiety, depression, things like that can happen, because we know very predictably what happens in the brain. If you throw a bunch of stress hormone in the brain, you will develop brain fog, but also anxiety and depression. And the challenge with those symptoms, right? They're considered conditions in and of themselves, but I think they're symptoms of an underlying problem, is that they're not just conditions in and of themselves. We know from like when they do testing on stress physiology, when they put rats in a model of stress that they call chronic, unpredictable, mild stress, so just too much stress hormone over time, that damages the brain, and those rats develop depression.
Mm-hmm.
And we think of those in
Not
psychological
surprising.
terms, of course, but I'm pretty sure that's not a psychological problem for that rat. That's just kind of damage from this stress hormone. So these symptoms are abound, but in women, we'll see problems with their periods, right? In menstrual cycles, you get thrown off. We'll see, um, more PMS or kind of what we call estrogen dominant types of symptoms, which is predictable. Again, you hit that ovarian hormone axis with stress hormone, you're going to develop this estrogen dominance, heavier bleeding, more problems, even contributes to menopausal symptoms. It's pretty fascinating because a lot of my patients will come in, and I have a lot of patients that are women, and they'll come in and around, or they'll track their symptoms to, everything started to go south in and around menopause. And when we look at the underlying physiology, actually the adrenals produce every ovarian hormone you have. They'll produce progesterone, testosterone, even some estrogen. And that offers some fine tuning to ovarian hormones during menstruating years. But, as a woman goes through menopause, those ovarian hormones are going to gradually go down. That's a normal, natural process. That's not a disease, right? But the adrenals are supposed to come in and increase their production of that hormone. That eases a woman through menopause without symptoms. Right, postmenopausally, when we test a woman's ovarian hormones, actually most of them come from the adrenals, not the ovaries. So when I have conversations with my female patients about those symptoms of menopause, like, that's an adrenal problem. That's not a problem with your ovaries. There's this deeper underlying physiologic cause. That's really what we have to get at to get after this and to really fix it ultimately.
It's interesting because, like we were talking about earlier, we wouldn't attribute it that kind, because I'm postmenopausal. I'm about to be 65 years old, and so it's but I went through menopause late. I was like 59 when I went through it, and I did have symptoms. But I was over a year and a half ago. I was diagnosed with adrenal fatigue. And through blood and saliva tests, didn't come out. So I actually tried to balance my estrogen and my progesterone because I was having such extreme symptoms. The night sweats, the chills, the hot flashes, at some point it just became kind of overwhelming. I've weaned myself off of that. I think I need to go in for a fresh, blood work and saliva just to see how it's flowing now. I feel better than I did before, going on the protocol, taking the vitamins and nutrients and minerals that I may have been lacking. And then I was worked with individually to work backwards. I worked with a functional medicine doctor, and that's how I became diagnosed, because I knew something was going on, and I knew there was a bigger picture, and I was going through a really tough divorce, and of course my adrenaline just, I was living, I could feel it, I was just shaky all the time. I could feel I was sweaty all the time. I knew, sometimes it's really obvious and sometimes it's not. I knew that was obvious, and I knew I was living on adrenaline. I just knew it. I didn't know what to do about it. They put me through sort of a protocol. Even being in the health world, I knew from the way I took care of myself, my sleep, my diet, my exercise, that part was all in check. But the other part, it was out of my control because of stress. My stress was just so my cortisol levels were through the roof. So getting my hormones more balanced also helped me sleep, which because I'm sure you help your clients with that. Let's talk about that. So we've kind of, how do you test for adrenal fatigue? You test cortisol levels, you test insulin. You alluded to a few things. What if someone comes to you and suspects, because they have these symptoms we've been talking about, what do you do? What is your testing? What's that? And then what is the protocol once you discover what exactly their source is. Let's talk about protocol. I know you have a complete program for it.
Sure thing. So the best way to test for adrenal function, and the adrenals are really kind of the only part of this stress response system, right? The hormones, the nerves, the limbic system. The adrenals are really the only part we can effectively test. So we kind of have to get that information and kind of peek through that window and see what's going on with the rest of that system. Treatment has to address the rest of the system, but at least we can test the adrenals. Saliva testing, right? So there's saliva testing. There's a kind of one lab that I like that gives us cortisol levels, and there's another adrenal hormone called DHEA, which is absolutely telling in the overall strength and function of the adrenals. The test that I do also has an immune marker. There's an insulin level and a couple other things on there, which gives us everything we need to know about the adrenals. There is a second test I'll quite commonly do for patients, and I used to do a bunch of different testing, kind of like a lot of your functional medicine doctors will do, but I've kind of dropped off doing most of those tests because they all tend to be directed at some of what I would consider these secondary dysfunctions, right? Like I used to do stool testing and it would always show up abnormal, or neurotransmitter testing, but it's kind of predictable how they look, because if you've got somebody in stress physiology, like what's going to happen.
Everything's going to be thrown off. Yeah.
Yeah. And to me, these are kind of secondary dysfunctions, right? Where, and trying to fix like the thyroid or the ovaries or the gut or the immune system, trying to fix those systems while your body is still purposely suppressing them because you're still in stress physiology. It's like trying to push a car that has the parking brake engaged.
Yeah,
right?
You're ahead of the cart, basically. Yeah, you got to go back. I get it completely.
So there's one other test that has held on, which is a food allergy test for IgG ELISA test, food sensitivities technically. I learned that if I identified and dealt with those reactivities, people felt better quicker, which is a good thing. I think that's just controlling a controllable stressor, right? We have to kind of scoop as much out of our stress bucket as possible.
Exactly.
We still have to fix this problem, right? Because this is why we have food allergies in the first place, with the suppressed immune and digestive system. And I've seen doctors chase after these food allergies, right? Oh, you have this and that's the problem. And they remove foods, but they don't fix this. And if you don't fix this underlying problem, you just keep losing new groups of foods, right? I mean, I've had patients come into me and they're like, all I can eat is chicken and broccoli, right? I'm like, all right, so we're not fixing this underlying problem. So that tends to be the shift.
Yeah, because it's
so those are really the only tests that I tend to run for this condition. And most of my patients, as you know, most of my patients have gone everywhere. I mean, they've been tested inside and out, upside down. They're
at their wits' end when they come to you.
Here's all my stack of, I went to Cleveland Clinic or Mayo. They can't find anything wrong. Now it's your turn. You're my last resort, kind of a thing.
Yeah. Yeah, so your testimonials are great. I recommend you guys go. Well, you're going to talk about going to the website and reading them. So let's talk about the protocol. What do we do? How do we heal? How do we heal adrenals?
Well, so we want to hit it. You mentioned a bunch of things as far as lifestyle goes, which is absolutely essential, right? Because either everything in our life, it's either kind of helping us, right, heal us, or harming us, right? So I view these things as stressors, right? We all have this one stress response system, which means it's got to deal with any and all stress. So I kind of picture it like a bucket, and problem is, the bucket wasn't really designed for the stress we have today. It was designed more for, old school stress, right? Like hardship and, a famine or a plague or a predator, right? Where we would fill up the bucket, we would use that stress physiology to survive. And then if we live, the bucket drains, we shift out of fight or flight. So we turn off the wear and tear, we turn on the healing and repair, and we live to fight another day. Well, as you well know, we fill up this bucket left and right with poor nutrition. I mean, anything, right? Physical stress, mental, emotional, spiritual, toxins and accidents and surgeries and injuries.
Life events.
Head injuries, all of it, right? Politics, relationships, work, social media, like it all goes into that same bucket. ultimately what we have to do to get this to shift is we've got to create space in that bucket, right? Because this bucket doesn't discriminate. It doesn't care if it's some responsibility or a food sensitivity, right? Or an old fear, or are we worrying about something we don't have control over, whatever. We want to scoop as much out of that bucket as we can. So to me, that's where all that kind of lifestyle modification comes in, which I warn all my patients, I'm a holistic doctor. We're going to try to treat this thing from every angle we can. I mean, I do use nutrients and supplements and herbs and things, but to me, those supplements, they're really just supplementary, right? It's like we're trying to repair a house, right? And we've got to get all the equipment there, right? Get the tools, the equipment, the lumber, all the supplies, right? That's all the supplements and nutrients. But what if nobody tells the crew to show up? Mm-hmm. Right? The way we tell the crew to show up is also to shift this physiology, right? Because our bodies know how to heal.
Absolutely.
They've been doing it for thousands of years. Mm-hmm. But we've got to turn that physiology on. And to me, in naturopathic medicine, I learned about the healing of nature. And, that means herbs and, going to the beach and putting our bare feet on the ground.
Yeah,
all those
grounding yourself and
all of it, right?
Yeah.
But the healing power of nature is actually our body's ability to heal itself, which unfortunately is shut off when we're, burning the candle at both ends and, mm-hmm. Going nuts with life, overscheduled, the whole thing. So our whole goal is shifting that physiology. So we'll leave diet out for a second, but yes, appropriate sleep, we have to get to that. And a lot of times to fix the sleep, we've got to fix this HPA axis problem. So we target those things. And I mean, I love the title of your website and everything about balance, right? Because it really is
so
about
many things. Yeah.
Balance, right? I mean, in so many ways, work, play, whatever it is. Then we want to target the diet. So there's very specifically, your adrenals control your blood sugar. Mm-hmm. So if your diet is not conducive to balancing your blood sugar, that's going to be a stress on your system. Well, that's a controllable stress, right? So a hypoglycemic diet is really kind of a good starting point for people. It's also interesting, your adrenals help you to hold on to salt. And when salt is off, your hydration is off. That's why mm-hmm. a lot of my patients will urinate more frequently than the average person, right? And so we talk about salt and those kinds of things. And, we target this from every angle we can. The difference, I guess, with what we do is not just targeting the adrenals, right? Like some vitamin C or ginseng or whatever. When you target the rest of the stress response system, the nerves, the hormones, target the limbic system in so many ways. And I'll give you one of the easiest ways to target that limbic system is with a simple relaxation exercise, right? I start my patients 10 minutes twice a day, quiet, comfortable, close your eyes, focus your mind on one thing.
Kind of meditation.
It could be meditation, but it could also be, it doesn't matter what you focus on. It could be deep breathing or visualization, guided imagery, repetitive prayer. Your limbic system doesn't really care what you focus on, just that you try, and which we can't do. Like nobody can stay focused on that one thing, right? So the mind dances away. We just bring it back. We have MRI studies, right, that show the damage in the brain, right, especially in those rats where you see hippocampal atrophy, right, where it damages the brain, stress over time. There was one study where they put people through a 6-week mindfulness meditation course, and they saw increases in hippocampal volume, literally changing these neurological pathways away from fight or flight. Because a lot of times the pathway from stimulus to limbic system to stress hormone, it's so well worn, it's not a pathway anymore, right? It's like it's not even a road, it's like a highway. Well, we can change that neural pathway, so now that stimulus doesn't have to go to fight or flight, it can stay and rest and digest. So relaxation exercise, really the key with all these various things is figuring out what everybody's puzzle looks like with relation to this stress response system dysfunction, and putting enough of those pieces of that puzzle together to shift that physiology.
Right. target
For
and
me,
shift it.
the only way I've learned how to figure that out is I need frequent contact with patients, right, to really kind of get
Yeah,
to
to
know
hear
them.
their progress on a daily,
Absolutely.
and my patients get a journal. My patients, oh, no patients, they're clients, but
Yeah.
they get a journal, so I get a sneak peek at that when we meet, because we meet only twice a month. But
Mhm.
when we meet, at least I can see everything that's happened in between and where the red flags are. If, oh, I'm still losing weight and I feel good, but I have a gurgly stomach, so I go back and look at the journal. You have to you got to kind of log everything for us to be able to help them. They have to take on the responsibility because they have the ability to heal. They really
For sure.
do. Now we're
For sure.
out of time, so I want this protocol that you have your healing protocol that people can just go online that I talked about at the top of the show. How can people who are not looking at the screen right now where your website is, tell them how they can reach you to get into this? And I think you also have like a free course, and you have the assessment test that I took that tells you whether or not your adrenals are shot.
Absolutely. Absolutely. So
So
if you just go to drandrewneville.com, Dr. Andrew Neville, there's a free kind of assessment quiz or questionnaire that gives you some ideas as to whether or not it fits. If you have adrenal fatigue, you can actually just reach out and schedule a complimentary call with one of my patient coordinators. I've got some of the most caring people kind of there to be able to talk this through and figure out if we might be a good fit for each other. And there's tons of resources, right? So I've got my YouTube channel, Instagram, and Facebook. I've also been doing Facebook live Q&As
I
every
saw
couple of
that.
weeks.
I was
I've been
watching
doing
that this
those. So
morning.
those
Yeah,
have been,
those are
yeah,
great.
really well attended.
Yeah.
Lots and lots of questions because there is a ton of mystery with regard to this condition.
Yes.
Because my doctor just says I have depression, or my doctor thinks it's my thyroid, and they're all kind of right. It's like that old parable of these three kind of blind men looking at an elephant, right, or standing around an elephant, right, one at the tail, one at the ear, one at the trunk, and they're all describing what they see, and they're all right, but nobody's able to kind of take them back and say, look, but let's deal with the elephant, right? And the elephant is this stress response system dysfunction, not just adrenal fatigue. Shift that physiology. So yeah, by all means, check us out on social media. My free courses there as well. So
Yeah.
we're just trying to get that information out there. That's the key.
It's really interesting. I highly recommend it because you take this. It says you need 6 minutes. It takes 6 minutes. I think it took me a little less, but all you do is take the assessment test and you see where you stand. And then which you said, you're such a resource on your website because then it recommended articles specifically like my diet, sleep, and exercise wasn't a factor in what's going on with my adrenals, but other things were. My stress levels were really high, and my nurturing. People who tend to be more nurturing and caretaking of places and things that are going on in their lives tend to live in a higher stress, and that was high. And so there were articles on ways to counterbalance exactly where I came out on that test. So I highly recommend you visit this website. I have to thank you for your time. I'm going to ask you to leave us with final words, a sentence, a word, final words of wisdom.
Well, I suppose if there's one recommendation that I could leave all of us with, right? Because this condition is so incredibly common. I mean, you'll see it. I mean, how many people have any of these symptoms, right? The one thing that I think can really help us all is this idea of mindfulness, of just being present, right? Mm-hmm. Being present in our lives, being present in, if we're going for a walk, right? Go for a walk, be in nature, and be present in that experience as opposed to, worrying about whatever finances and work and that argument you had, or where be as present as you can in each of these kind of instances when you sit down for lunch or dinner. Be present, be thankful for the food, enjoy that food, feel the texture, taste. If we can be present,
it's a great start. Right.
We have this ability to create lions and tigers in our brain, right? But right here and now, in front of this meal, There's no stress. I can be balanced. So
I love that.
mindfulness, be present.
That's true. I had a Ayurveda practitioner doctor on the show last month, and she said exactly the same thing, just in terms of living in harmony with nature, because that's what we were meant to do. So
Absolutely.
stay present, stay peaceful within. You need to take the time to taste your food, the way you eat, where you eat, how you eat. All of that comes into play to an overall healthy lifestyle. So she said exactly the same thing. So there's experts out there telling you, so take heed, my audience. I want to thank you again, Dr. Neville, for taking your time today away from your practice and your family, because it's getting late. I really appreciate it. And then I want to thank you, my audience, for joining us today. And I want you to keep going out and having those conversations that connect to a healthier you. We'll see you in 2 weeks, everybody. Bye. Thank you.